All right, so I have no idea what the heck week it is. I think I missed a week or two for the residency reflection coming up on Thursday of this week. So I'm just going to combine the last couple weeks kind of into however many weeks it was. One kind of overarching reflection, overarching. Not sure how to say that. But basically, inpatient rehab's been going well. I've been really enjoying it. Past couple weeks, I've been working primarily with patients with spinal cord injury. So I had a patient with a T12 incomplete Asia D. Currently have a T5 complete Asia A. A couple times I worked with a patient with an L2 Asia D. A pretty dense left MCA stroke. I'm going to kind of do a case presentation just for the channel. I don't have to officially do one on that patient just because I think it's interesting. And then I've been continuing to co-treat with a few patients that I was co-treating on before with bilateral cerebellar infarcts and things like that. So pretty much SCI and stroke. I did have a Guillain-Barré patient, but I think I already had talked about that one in the last reflection video I did. Hoping to kind of get back on the video saddle. My weekends have been pretty booked up and are going to be pretty booked up over the next couple months, so I'm trying to figure out a better kind of flow or routine to do a lot of the filming during the week. Just because in the past I've done a lot of it on the weekend, so I'm trying to figure out how to do it during the week. But during the reflections, so yeah, it's been going really well. I've been feeling more and more confident working with some of these patients that require more assist or are patients with spinal cord injury that are kind of different types of transfers than maybe we're doing with some of the patients that I was working with in acute care. Some ceiling lift transfers, some popover transfers, some T transfers, that kind of stuff. So it took a little getting used to, but after a session or two, felt pretty comfortable with it. Have been trying to incorporate gait training, especially at those higher intensities, as much as I can, while also trying to not ignore some of their other deficits and kind of balancing how to do that. Probably the biggest challenge the past couple weeks has just been documentation. So in this newer inpatient rehab setting, there's a lot of extra documentation for evals and discharges than there was at the acute hospital, and I've kind of been struggling for getting some of the little extra nuances for different patient cases that, like, oh, you have to check off this extra box or check off this extra little section because they're this type of patient or they're getting this type of equipment. Or, there's an extra thing that you have to do on an eval that's not even involved with patient care, but is involved with the documentation of it. So kind of talked to my mentors about how I can make myself some checklists to be a little bit more diligent about that. And then other than that, it's been going pretty smoothly. I absolutely love it. I love getting to spend 60 to 90 minutes with a patient. I kind of like the little bit slower pace of things just because I feel like I can apply more of my neuro-specific skills to these patients in neuro rehab. And then on top of that, I've been kind of getting some more things in motion for my scholarly project. Hopefully within the next week or two, I'll have like a finalized kind of plan and idea and start working on some deliverables to get towards the final project. And then I can kind of present it to the channel. And then on top of that, I've also been working, getting training for working weekends at the acute care hospital. Because we were only trained in neuro stuff when we were there, I needed to be trained on the ortho, vascular, and cardiac teams, just in case I have to eval or treat one of those patients. A lot of times there's joint treats on the weekend, and then the other disciplines can get a lot of evals on the weekends. So I have my first weekend coming up this Saturday, March 27th. So that'll be fun. I'll get to hop back into acute care a little bit. Kind of hoping they give me some of the neuro patients that have to be seen on the weekend with stroke protocol and things like that, but also feel ready to hop into the other services as needed. And yeah, other than that, residency's been going well. The weather in DC has kind of been fluctuating, but I've been able to make some friends in inpatient rehab and keeping my friends from acute care, so that's nice. And yeah, just keep plugging away with it. I really like kind of our mentoring style here. There's a much more kind of fluid flow because everyone can see everyone's schedules at inpatient rehab, so it's real easy to ask for hands or have somebody come to a co-treat with you if they have a specialty in an area, or you just want an extra set of eyes. And it's kind of nice to be able to schedule those things and schedule some co-treats and stuff. Another thing is we just did get a brand new aide who got a degree in business with a minor in sport management or something like that, and decided he wants to go into PT. He kind of always thought he wanted to go into, sorry about that, kind of decided he always wanted to go into PT, but wanted to do that while he was playing sports in school, and then now he's working as an aide, kind of studying for exams to get into grad school. I didn't have to take them, so I can't really give any input into that, just because Ithaca is a straight-on-through program. But so I've been able to kind of do some sessions where he's joined patients and I with kind of teaching some transfers and things like that, and it was kind of nice because it's like I feel so novice a lot of the times just compared to some of these expert mentors that I'm working with all the time, and it was kind of nice to see how far I have come since even just graduating 7 months ago or whatever it was, 6-7 months ago, and just how much opportunities Ithaca College gave me to learn, and then how much opportunity the residency's given me to learn and grow. And so I'm excited to keep going in inpatient rehab. I still am really enjoying it. I like really trying to push patients and get them up and moving. But hoping I can get some more content out. I know I've been kind of saying it the past month or two, but I'm trying to work on altering some of my systems to get some more videos out. So that's this couple weeks, I don't know how long, residency reflection, and thanks for watching.